Welcome to
Thank you.
Empowering Women podcast. I'm going to pronounce your name. Tell me if I did this, if I'm saying it correctly. So, Dr. Darlene Neg Benidor.
Correct.
Correct. Beautiful. Okay. I could never pronounce it, so I'm always saying Dr. N. But
You're not the
welcome.
only one.
Welcome, welcome. So, what I like to do is I like to read a little poem at the beginning. So, if you don't mind, if you'll bear with me, so I can just read that poem and then we will go forward.
Sure.
So, this poem is entitled You Are More Than Your Gut, and it was written by myself, Leslie. So, a woman, we carry stories in our bodies, stories of anxiety, doubt, fear, stress, pain, and strain, stories of sleepless nights and silent battles. We sometimes have joy, we sometimes have pain, but deep within, a world is growing, a world that is sometimes chaotic, but we still miss. A God that speaks when life feels heavy. The body is asking, what is this? We learn to listen to our bodies, but sometimes ignoring the signs it sends. We learn that healing is a journey and self care is where our strength begins. Woman, you are not weak because you're tired. You're not broken because your body aches. You are just learning daily to honor every choice you make. So, woman, listen to your body, your mind, your voice, your heart, your spirit. You are worthy of attention. You are strong. Your gut speaks in whispers. Your body may slow down, but every time you choose you remind yourself and the world, I know my worth now. Empowerment is not perfection. Having strength is not pretending you're fine. It is knowing when to listen to your gut. Seek support and let your light shine. So, right on, dear woman. You are strong, courageous, and fearless. Your peace, forgive, and forgive yourselves. For when you care for the woman God created you to be.
I love that.
Thank you.
Wow.
Thank you. So, let's start with you, Dr. N. If you would not mind just telling us a little bit about yourself and what inspired you to become a GI.
I am a board certified gastroenterologist. I practice in Stamford, Connecticut. I have always wanted to be a physician. Partly that's part of my Nigerian heritage. It's very common for Nigerians to go into medicine. GI particularly, though, I came to by way of a rotation in college at Mount Sinai in the liver transplant division, and I just fell in love with the liver.
Wow.
And in doing so and being part of that team where we evaluated patients pre and then followed post-transplant, I really just got enraptured with the field in general, and then learned that I was really good at sort of the science of GI. It came very naturally to me. And then procedurally, I took to the procedures that we do. So it was a perfect fit.
Wonderful. That sounds great. I hope some little girl is listening somewhere and will be inspired by that.
I hope so. That would be great. We need more women in GI,
We
believe it or not. We need a lot more.
We do. What do you enjoy most taking care of women?
I actually enjoy what would not seem to be like the medical part. I like interacting with my patients, and I think there's such an intense mind-body connection that in really tapping into a lot of what's going on in someone's, personal life and what's going
Yeah.
on in their day to day really impacts my insight into their, underlying medical problems.
Wonderful. What are some of the most common digestive health concerns you see in women today?
I would say many postmenopausal women have complaints of
Mm-hmm.
bloating and abdominal discomfort.
Mm-hmm.
Change in bowel habits is fairly
Mm-hmm.
common in postmenopausal, and everyone is reflux, heartburn, um, and um, and fatty liver, which is really not a symptom per se, but you can see a lot of abnormal liver function tests as a result of how we eat and our diet, and particularly, again, postmenopausal women tend to have a lot of this stuff present as it becomes easier to gain weight after menopause.
Yeah. I am perimenopausal. And when this started, I had no idea that's
Yeah,
what it was.
yeah,
The big thing came to my mind because my breasts, I was having a lot of pain, a lot of burning. I'm like, I don't have cancer in my
right,
belly. So what could this
right.
be?
Mm-hmm,
And so
mm-hmm,
my daughter, I was so worried, and I called up a breast surgeon, got an appointment. And when I went in, first of all, I went to my gynecologist and he gave me a script to go to mammogram. So when I went and I started telling them all the symptoms, he was like, "We cannot do a regular mammogram. We have to do more. We need to do an
mm-hmm,
ultrasound. We have to go a little bit deeper." So I
mm-hmm.
had questions to the doctor, but my daughter did her research and she said, "Mommy, I think you're perimenopausal."
Mm-hmm.
And
Interesting.
that's what the pain was horrific.
Oh, wow. Mm-hmm,
I mean, I was in so much pain, so much burning, but there was no symptoms. I mean, there were symptoms, but no signs of,
mm-hmm, mm-hmm.
what I was thinking in my head. But menopausal can be very, very, very serious.
Yes, yes, for sure. But you also did the right thing, which is to really get evaluated and not to chalk up your symptoms to
Yeah.
menopause. So, in that sense, it would be a diagnosis of exclusion because we really don't want to miss something as serious as, let's say, the
Mhm.
breast cancer.
Absolutely. Absolutely. So the next question that I would like to ask you, and I'm sure everybody probably would want to know this, why is it important for women to pay attention to their digestive health?
It's very important for anyone to sort of be mindful of their GI symptoms.
Mm-hmm.
And I'll answer the question first, anyone, because your GI symptom, I had someone who trained me who used to say, if you want to be number one, you got to know everything about number two. And in some sense, while that's sort of a joke, there's some truth to that, in that, our GI system has its own nervous system, and it really sort of reflects a lot of underlying metabolic disease.
Yeah.
A person who is anemic, a lot of the times we need to make sure that there's not bleeding in the GI tract. A change in bowel habits can be a sign of malignancy. It could also be a sign of hypothyroid. So there's a number of sort of like intersecting medical diagnoses that
Mm-hmm.
go directly through the GI tract.
Mm-hmm.
So everyone should be mindful of their GI system. But I do find that women particularly, and what resonated to me in your poem, is that there is strength in self-care. Women are so used to being in charge of everyone else's health, the children, the spouse, the parents. We're in the sandwich generation where we're taking care of our children and our
Mm-hmm.
parents. And I think there's quite a bit of neglect there. And unfortunately, what I end up seeing is, for women, particularly a woman who, maybe had symptoms at some point that were signs of early disease, but I may see them later in their diagnosis at a more advanced state because they haven't taken the time to address symptoms they were having, namely because they were caring for everyone else.
Absolutely.
So, in that sense, yes, it is very important for women who tend to be the caregivers of everyone in the family to also have self care and be mindful of their own GI symptoms. Alarm symptoms that one should be aware of: change in bowel habits, number one, blood in the stool, unusual weight loss, because we know how hard it is to lose weight. So if one loses without trying, that can also be an alarm symptom. Ongoing abdominal pain that doesn't go away. There's a number of things that and I'm thinking of particular patients at this time that have these symptoms that, chalked it up or ignored it because they were busy taking care of everyone else.
Everybody else. Taking care of everybody else. We've been pausing, and I'm not sure why. 100% correct on that. We're living such a sandwich generation, as you're saying, and the ones were usually, especially the single moms, ones cooking and cleaning and working 3 jobs. And sometimes have an elderly parent that we still have to attend to.
Exactly.
What is the connection between gut health, you would say, and overall health?
Gut health, depends on what way you think about it. There's 2 ways. There is a sort of gut health in terms of like our gut microbiome. That's a sort of intangible health that it's hard to quantify. But sort of eating healthy whole foods can sort of maintain that microbiome. There's a lot of data that suggests that the pathogens and the bacteria that are in our gut are directly associated with various systemic diseases like Parkinson's, diabetes, obesity. And so eating whole, well-enriched foods and maintaining a healthy microbiome can help prevent some of those diseases.
Yeah.
The other is there's an increasing incidence of colon cancer in our society, and we're not quite sure why that's happening. Is it related to the types of foods we're having? Is it related to carcinogens that we're exposed to on a daily basis, like environment? That still sort of remains to be seen. Is it a certain bacteria that's, sort of living in our GI tract that predisposes certain people to cancers? We're not sure. But that also, leads to this idea that, a healthy diet, a diet that does not incorporate a lot of alcohol and saturated fats and animal fats, can, 1, promote healthy gut microbiome, and 2, prevent underlying diseases, not just GI tract, but systemic diseases.
Okay, thank you. So what symptoms do you think that people in general, women, should not ignore?
Certainly the most obvious is blood in the stool. Blood in the stool is not normal. Sometimes it can be related to something that's very mild, like a hemorrhoid, which is an innocuous thing, can be bothersome, but it's not associated with increased mortality. But it is not normal, and it can be associated with things such as colon cancer, colon polyps. Other things is a change in the bowel habits. Not everyone goes every day, but whatever is your normal, if there's a change from that should prompt, a visit with your primary doctor, and then ultimately a gastroenterologist if warranted. Unusual weight loss, as I mentioned before, and abdominal pain. Those are sort of the classic alarm symptoms, things that would prompt further evaluation.
Oh, we're pausing. Some computer, not sure what it is. But I would say this for me. I know for me personally, I get stressed out for a lot of things. I have faith, I believe in God, I trust the Lord, but sometimes being human. So for a woman who would sit and maybe she's constipated, right? And she wipes and there's a little streak of blood, and we know she's constipated in her head, she's thinking, oh my God, right? So what should the flow be like? How much? What's the amount that you should seek that would bring concern? because it's just constipation, and it could be more than once, and they're thinking it's something else.
I think that if something happens consistently, one should get it evaluated. And there's nothing wrong with going to your doctor and it ends up that you're being told it's a hemorrhoid. It's totally fine. But it is not normal to see blood in the stool. So, really any amount should be evaluated. Not every amount will necessarily warrant a colonoscopy. Maybe you'll get an evaluation and there'll be an actively bleeding hemorrhoid, and in that sense your doctor can tell you that your bleeding is related to hemorrhoids. But I think it's worth getting evaluated regardless of the amount of bleeding. It's not normal to see blood in your stool. Some people, once you've been evaluated and you find out, there's nothing or there's only hemorrhoids, yes, you don't have to go to the doctor every single time then after you're told that you have a hemorrhoid that's bleeding, especially if it's associated with straining or constipation. But it takes just a phone call to reach out to your doctor for them to kind of tell you, what the next step is. I just think people should have a really open dialogue with their primary doctor, which is why it's important to pick a good primary doctor, one that, you have great access to, that you feel comfortable sharing intimate details with. And then that doctor can refer you to a GI specialist if needed.
Thank you. And I can say for you, I think you're a great doctor, because it's very important when you go to a doctor and you're able to communicate your feelings and able to ask questions, and the person has the time to listen and to respond. They're receptive to whatever your situation is, but not everybody has that experience. Your office, and it's just a wonderful feeling, the way how you make your patients feel. So I thank you for that. I really do. How can stress affect the digestive system? I think stress is
so the GI tract has a nervous system, so sometimes people who are particularly anxious, the same hormones that are released when you're nervous also have receptors in the GI tract, so sometimes it can cause a more rapid transit in the GI tract, which is, classic. Someone's very nervous, they have to run to the bathroom. But it also can cause a slowing of the GI tract too. It's a very sort of sensitive organ that responds to, hormonal and neurotransmitter stimulants.
Okay. I even think since I became perimenopausal that I feel anxious. Like I feel like I'm suffering from anxiety. Sometimes my stomach feels weak. I think women go through a diverse amount of things, because I've heard from other women that their symptoms is nothing like mine. But it's crazy.
Yeah. I mean, I think we're finally paying attention to sort of how complex the female hormonal system is, and how much estrogen and progesterone and that balance plays in our homeostasis, how well we feel. And that's like a growing field, finally. There's a lot of physicians, male and female, in this area that specialize in this sort of, postmenopausal, perimenopausal health. Some places it's still difficult to access and find physicians that can guide patients through that. But we're lucky in this area to have that. A number of doctors I know do that sort of care, women's health care.
How long does the perimenopausal last, and how do you know when you move over to post?
So you're considered in menopause when you've had 1 year without a menstrual cycle. So that's silly, because 364 days you're still considered perimenopausal. until that 365th day, and then you're considered postmenopausal.
Ah,
So it's a range, and and I said it flippantly because obviously your symptoms in peri and pre and post are very similar. So it's just a matter of a scientific start and stop point.
and it differs from woman to woman.
Exactly.
So, next question for you. Are there certain digestive issues that women experience more than men?
I do think women tend to be more bloated than men, tend to feel that more, especially postmenopausally.
Mm-hmm.
And I do think that women tend to have more pelvic floor issues, meaning, urinary incontinence, rectocele, rectal prolapse, weakness in the rectum, fecal incontinence. I think because the pelvic floor, which holds up a lot of the pelvic structures, the uterus, the bladder, the rectum, gets weaker over time and is impacted after childbirth. So that weakness in the pelvic floor can cause any number of those symptoms. Also, hemorrhoids, again related to childbirth, are more prominent in women, although men, of course, can have hemorrhoids as well. But I feel like a lot of pelvic dysfunction is more common in women than men.
Mm. So, what are some common myths about digestive health that you've heard?
Common myths. Yeah, I don't know. A myth. Oh, here's one, I guess. Some people think that if you don't eat, you won't have a bowel movement, and that is not true. Your body sort of makes stool regardless, and fasting. Let's say for whatever reason, let's say you fast for 24 hours. It doesn't mean that you won't have a bowel movement.
Okay. Why is it important for women to speak up? What would you tell them when something doesn't feel right? Because sometimes we see signs, we know something is wrong, we feel it, but we have to go to work and we have to take care of the kids and, we have to do and we have that to do, or we don't have the money, we don't have insurance. But when should they speak up? When should they speak up?
Well, I think that women have great intuition, and simply as you said, you've got to listen to your body, and that's for men and women. But I think women in general have very good sort of intuition.
More
While
so
women
than
may not, I think it's fair to say that we're definitely very in tune to our bodies. Now, whether or not we act on what we're feeling, out of fear, out of a lack of time or resources, is a different matter. But I do think women can sense when something doesn't feel right. So I think giving a woman just sort of the impetus to really take care of yourself, because if you're not healthy, then you're not going to be able to help anyone else in your home or in your world. And I try to do that with my patients all the time, is sort of encourage them to really take time to reflect on how they're feeling and to address symptoms that they may have poo-pooed for some time, because I think in doing that, you give patients the permission to take time for themselves.
Yes. And if someone is watching and they feel that their symptoms are being dismissed, right? What should we do? What should that woman do?
Well, if you feel like a doctor is dismissing your symptoms, you got to find another doctor. And that can feel hard because maybe you've invested time, or maybe you feel like you took the time to go to the doctor and you're being dismissed. Oh, it means the symptoms weren't important, wasn't a bother, wasn't something you should be concerned about. But that goes back to, and I have to remind myself too, I've been in situations where I feel like I maybe the person I was talking to wasn't taking my concerns seriously. And it takes some strength to sit back and have confidence that whatever the case may be, even if it is something that's not serious, if you've left that interaction feeling that you're not assured or feeling that there's still something wrong, then you have to move on and find someone else.
Absolutely. I was speaking to a nurse the other day, and she was telling me that her doctor, the way he treated her, she was not happy with him at all. At one point, she had to say, "I am an RN." She's now retired. And I said to her, "But whether you're an RN or not, because some women are not able to advocate for themselves, maybe, like you can, when you use your language, right? So whether you should be open to you regardless." That was what she said, and then move on and find someone else.
Yeah.
The better choice. Right?
Yeah. It can feel hard to do, because you sort of open up to somebody, and that is a relationship for sure. But if it's not working for the purposes of sort of, maintaining your health or making you feel confident that, your issues are being addressed, then it isn't a relationship that is serving you.
Absolutely. And what questions should women ask their doctors? Because I know there are people that go to the doctor and they don't ask any questions. They just go with the flow, right?
Yeah. Best question I feel like a patient asks me is, when should I see you next? Sometimes people, they make the appointment and they get the assessment for the thing they came into, but I think it's important to leave with a plan of action of when you need to go back to have this reassessed. Sometimes we do something and there is no problem in trying something as long as you give yourself an appropriate time to reassess what you've done. Okay, your rectal bleeding, I think it's hemorrhoids. Try a high fiber diet, try extra water, try a stool softener. But then the next question and the next beat, we have to reassess. You can't go 10 years with rectal bleeding and say that it's hemorrhoids. So it's for us to have a common language and a common understanding of when is the appropriate time to reassess an issue. And then once we've come to a resolution, when is the next time we see each other again? A GI physician, while I don't see my patients all the time, especially if they don't have chronic diseases, it is a relationship, so there is a time where we should see each other again. Colonoscopy is at 45. Next time you do it, 7 to 10 years later, we should see each other again. Upper endoscopy for reflux, when should we see each other again? Once a year, just to see how your reflux is doing. So GI doctor, which is part of what I love, really is part of your general health maintenance. We don't see each other as much as you see a primary care doctor, but it is a relationship that I like to see through the decades.
Thank you. I'm going to ask you this from your perspective. Why do some women delay seeking medical advice or medical care, rather?
Well, it was probably fear, lack of time, lack of resource. I think we all have different personality types. Some people are afraid for what they don't know, and some people sort of are afraid to ignore something because it may end up being something. So it's a personality type that's fearful of the unknown, afraid of what they may hear. Some people just don't have the time, a lot of jobs, a lot of responsibility. It can run the gamut. Don't have the money for co-pays. Life is hard for a lot of people financially.
It is.
So there's a lot of reasons why people don't come to the doctor.
It is. Especially with having no insurance. It can be really tough.
Yeah. Or underinsured, having insurance, but the co-pays are so expensive. So for that, it can be really tough also. It can be very expensive. It can be difficult.
Very difficult. What would you say to a woman who may say, and I'm trying to figure this in my mind, that she feels embarrassed discussing her digestive problems?
I think that's fair, but you have to find a doctor they feel comfortable talking with. And really, there's nothing that, I can't think of a single thing that a patient's ever said to me that I hadn't heard before. Like
Yeah.
really, there's very little that's unique to us. GI doctors have heard it all. Primary care doctors have heard it all. All the doctors have heard it all. There's nothing super unique. And even if it feels embarrassing to you, it is not embarrassing for us to hear it. So if it gets you closer to feeling better and healthier, just share the information. It's helpful to have the full picture. But just rest assured, we've seen and heard it all.
That's right. Okay, ladies, you heard. You've heard it all. So just share. No embarrassment should be in your book. So what is the difference between a normal digestive issue and something that requires medical attention?
I think, if you have a symptom that has been present for long enough that it's concerning to you, that is a symptom that requires medical attention. Let it be after having a discussion with your doctor that they say, this is normal and nothing to worry about. I do hear things that are normal. I mean, sometimes people say, oh, my stomach's making a lot of noise. Mm-hmm. It's normal to pass gas. So there's a lot of things that are normal, but if you're the only person, you may not know that what you're experiencing is what everyone else is experiencing. Believe it or not, it's very common to have hemorrhoids also. There's a lot of things that are common and not necessarily worrisome. And maybe I know that because I'm a physician and because I see 50 people in a day with the same symptom. But for that person, that may be their only experience, and so they won't know that that's normal. So I would say it's best just to have a conversation with your doctor and find out if what you're feeling is normal or abnormal. Again, trust your gut.
Absolutely. And there are some people who think that they're going through a situation and they're the only person in the world that's going through that. But there's always somebody else that has the same issue.
Exactly.
Always. How can a woman recognize when bloating may be more than just ordinary bloating?
Well, bloating pretty much should always be evaluated, primarily because for women anyway, bloating can sometimes be associated with ovarian cysts or cancers. Mm-hmm. So it should always be evaluated. But in the absence of that, bloating can be related to the type of bacteria in your gut. It can be related to certain foods. It can be like lactose intolerance. Mm-hmm. It can be associated with constipation. So most of the time, bloating is a benign thing. The only time I've ever worried about bloating is if a woman says, I've never seen a GYN about it. And then I say, you know what, you should always see a GYN just to make sure your ovary is okay, that, like polycystic ovary or an ovarian cancer. And if that's all negative, then bloating, while bothersome, is not worrisome.
Okay. When should someone seek, well, I think we went over this, right? Seek medical care for abdominal pain. I think you went over that. I won't ask you that again. So how important are screenings and preventative care?
Yeah, it's super important. For GI, it's a colonoscopy at 45. It used to be for African Americans, it was 45, and for the general population, for African Americans, it was 45, and for the general population, it was 50. Now it's 45 for everyone. We might find that for African Americans, in the future with more data, maybe that'll start being a little younger. That remains to be seen. But certainly to stay on top of the colonoscopies and to do your appropriate interval. Know your family history of cancer, stomach, colon, breast, ovarian, pancreatic, would give us a clue as to things that you may be at risk for. And so your screening time and age of onset may change based on that. And then, maintaining that after you do your first, follow-ups are important.
Thank you for that, because my next question was actually going to be what role does family medical history play in digestive health? So you just answered that. I personally think that culture sometimes plays a big role in people's ideology, don't you think?
Yes.
With medication, sometimes it's personal and sometimes it's a cultural thing.
Yes, 100%. Yes,
Um,
100%.
what is one thing you wish every woman knew about her body?
I just think people need to know what's normal for themselves,
Mhm.
and know what it feels like to go to the bathroom regularly, what it feels like to have normal digestion after eating. If you know what feels normal, then I guess you can. It's easier to know when things are abnormal, when there's a change. Um, so I would say that's most important. Know
How many,
what's normal.
how many times a day you think would be appropriate for bowel movement?
There isn't any. It's just what's normal for you. Like I have patients who go three times, 4 times a week, and that's normal for them, and then that's fine. So what's normal for you,
Healthy.
maybe 3 or 4 times a week. So then if you start going every day, that might be abnormal for you, which would warrant a workup, right? Or
Mhm.
if you start going once a week rather than 3 times a week, that's also a change from your normal and would warrant a workup.
Okay. Is there a healthy amount of times per day?
No,
No.
no,
Just depending on the individual.
yeah.
Okay. What does empowerment mean to you as a physician, or being empowered?
As far as for a patient,
Yes.
so I think a patient empowerment is sort of knowledge, and feeling comfortable in a situation so that you communicate your needs,
Mhm.
and also communicate when you feel like your needs are not being met. So it's knowledge, and it doesn't have to be sort of intricate medical knowledge, but understanding, what you hope to get out of the relationship, what your family history is, what your own personal history is. So acknowledgement, having a knowledge of your own medical history helps you become empowered.
What are some of your patients' most, I'm sorry, pressing concerns when someone
Usually,
comes to see you? Like you could say, if you were doing a percentage, what's the most pressing concerns that you see women face today? Concerns that they have that they need answers for.
the most common thing that I think women are concerned about, as I said, is probably the bloating and
Mhm.
sort of digestive health, how they tolerate certain foods, how they feel after certain foods, and their bowel habits, either constipation or diarrhea. That tends to be the most common complaint that I have from women. The most bothersome thing is, particularly women feel like they feel uncomfortable after meals, feel uncomfortable in their clothing,
Yeah,
that sort of thing.
thank you. How could women become more confident then in speaking with their healthcare provider? What advice would you give them? If they're not
Just
confident, you're not asking questions, they're just whatever. How
I
would
think just being able to, talk to the healthcare provider like you would talk to a close friend, in terms of candidness, right?
Mhm.
And understanding that we are there to help you feel better.
Mhm.
So, sharing that information as much as possible will get you there.
I'll share this with you. I think when I was 21 years old, a couple of years ago, I had a gynecologist, and I was having a lot of difficulties with my second child. I have two children. I was in the hospital in and out for 7 months. 7 months out, being admitted, discharged, admitted, discharged. And this is how I actually developed reflux. They did not know what was wrong. They kept giving me like a little pink pill, and
Mm-hmm.
would give me the IVs because I could not eat. I went down to like 97 pounds. And I
Oh
remember
wow.
the doctor saying to me, "You're disappearing." This is the doctor that I switched over to. And they actually wanted me to abort the pregnancy. And I said, absolutely. But my husband and I went in with the money because it's your life or the baby's life. And we decided we would not do that. So we did not do it. Thank God she's here today. However, the doctor I had before that, she had said to me I was bringing all my concerns to her, and this is why I switched doctors. And she had the nerve to look at me and said, "We're not friends." Okay, so I think I lost her, but that was a very powerful discussion that we were having. So I'm going to go back and I thank her because she just texted to say her phone is dying, but that was very powerful. Oh, you're back.
I had to relocate.
Okay, so I'm not going to keep you for much longer. I'm just going to wrap up by asking you a few questions just to, end the show off nicely. So, what I want to ask you here is let me get to my question. How can a woman maintain their hope for answers or healing?
How can a woman, I'm sorry, you cut out for a
Maintain
second.
their hope for answers or healing.
Well, I think women just need to have confidence that you have the right to ask anything about your health and your care that's going to make you feel better and
Yes.
comfortable. And when you have the confidence that you're going to find the person that addresses your concerns, then you can demand that care. And it's not to be, it's not to say that that this is an abrasive kind of confrontational relationship. What might be right for one person may not be right for another. But if you're confident that the doctor that's right for you is out there, or the healthcare provider that's right for you is out there, then I think it gives you the feeling like whatever your issues are, someone out there is going to be able to address them. Someone out there is going to have the expertise that you need.
Absolutely. So, how do you balance faith, medicine, and caring for your patients?
Medicine is a science, and sometimes people think that in order to be a person of faith, you can't be a person of science. I think they really interact and intersect very closally.
It does.
I think of myself as like my brother's keeper in the sense that I am, have been given really a gift and the privilege to be involved in a person's care and in the most intimate parts of their lives. And it's a responsibility that I take very, very seriously, and it's a privilege. And I think that when we do the Lord's work, the work is to help heal and to also be a safe place for people. And the people don't have, they don't have to be your family, friends, colleagues, and patients. So I approach each patient like they're an offshoot of my family, and that I want them to leave our interaction feeling cared for, feeling appreciated, feeling respected.
Very important.
That I think I think that's the Lord's work, and we all have our ways of serving, and that's my way of serving.
Yes, absolutely. I agree wholeheartedly with that. What would you say to a woman who is going through a difficult health journey? What would you tell them?
You need support. That support can be family, friends, coworkers. Allow people to help you. Allow people to take you to your visits. Have someone with you at your visits that can sort of record and help you remember what was being told to you. Sometimes it can be very overwhelming.
Yeah.
But also allow yourself to be vulnerable and ask for help. Sometimes people don't know how they can help, and that can be hard to, ask for help when needed. But people can't help you if they don't know exactly
What you're
what you
going
need.
through. Yeah.
Yeah.
I see doctors as an instrument of comfort and healing, and that's basically what they are. God's gift to people to help them through their life's journey. So I really appreciate you, Dr. N. I don't want to butcher your name.
Did
Okay.
so well.
I really appreciate you and what you do for your clients and your patients. What encouragement would you give to a woman who is learning to take better care of themselves?
Oh, well, it's a journey. It's a journey. I'm on that journey myself. I think by nature, we're constantly learning and constantly having to remind ourselves
Yes.
to, I wouldn't say put ourselves first. I think it's hard to get a woman to do that above, let's say, her children or even her parents. But I do think you've got to be in that list of people that, you give time to yourself
Mm-hmm.
to, meditate, whatever it is that's restorative for you.
Yes.
That must be that's part of your responsibility as well.
Absolutely. Absolutely. So, if you could leave every woman that's listening today with one message about their health, their bodies, and their health, what would it be?
Well, I feel like you said it better than I could ever say it, which is, self-care it's not selfish. It's a responsibility and it should be a priority. I really loved your poem that you started out with. I almost felt like you were preaching to me. You're preaching to a lot of women I know. But it's important. It's important to make yourself a priority, and that is not selfish.
Absolutely.
That can be, that's just part of the whole you, and you cannot be any good to anyone else if you haven't taken care of yourself physically and mentally and emotionally.
How would you encourage them to advocate for themselves?
Just have to speak up. You're doing yourself a disservice, and you're doing a disservice to your provider if you aren't sharing what's going on in your mind and what's bothering you and what you're not getting out of the relationship and what you're not getting out of the visit. Because most physicians, nurses, advanced practicing nurses, everyone, they want their patients to leave feeling like they were heard.
Yes.
But again, we can't hear if you're not speaking. So you've got to say what's bothering you so that we can help address it.
Well, I
And
thank
if it's not happening, move on.
Yes, absolutely. So there you have it from our dynamic gastroenterologist, Dr. Darlene Nagbenipor. I finally got the name. My
You
goodness.
did.
I
You did it.
thank
You
you
did it.
so much for taking
Yes,
time
thank
out
you
of
so
your busy
much.
schedule to be here with us today. This was dynamic,
Thank you.
powerful,
Thank
informative.
you.
It really was. So I thank you so much for that.
Thank you for having me. It was so great. You made me take a break from my on-call to really have a nice conversation. I appreciate it.
See, I thank you for your dedication, your knowledge, and your compassion. It's profound. Thank you. Thank you so much.
You're welcome.
And I hope you
Thanks for
will
doing this.
follow your advice too, and take care of your whole self, right?
I will do that. Doctor, heal thyself, right?
Yes, yes. Take care of the whole body, mind, body, and soul.
Right.
So, woman, you heard it. Men too. Your health matters. And your question matters as well. So your voice matters. Never be afraid to speak out for yourself. Thank you, doctor. God bless you, and God bless the USA. Thank you so much.
Thank you. Thank you for having me, and thank you for doing this very important work. Thank you.
Thank you. God bless you.
All right. Take care.
Bye.
Our strength is unstoppable. Our future is now.